Hello, Mrs. Winnick.
Hi.
How are you today?
Oh, good, thanks.
Good. My name is Emily. I'll be your nurse today.
Oh, okay.
Okay. Can I please have you state your full name and date of birth so I can confirm it to your wristband?
Mary Winnick, January 12, 1935.
Excellent. And do you have any allergies, Mrs. Winnick?
None that I know
None
of,
that
no.
you know of? And are you experiencing any pain right now?
No, I'm not.
No. Okay. I'm going to be conducting a head-to-toe assessment on you today. Just assessing everything and let the doctor know how you're doing, okay? Your status? Excellent. Okay. Do you mind if I take my pen light and look into your eyes? I'm going to shine a light into your eyes.
Sure.
Excellent. Thank you. Okay, I'm going to look in this eye first. Okay. Excellent. And your pupils were constricted to light and they were reactive with the light as well, so that's excellent. And could you do me a favor and follow the end of the pen with your eyes while keeping your head straight?
Okay.
I'm just going to bring it into your nose and then out. Excellent. And can you also do me a favor? Could you keep your head straight again and just with your eyes look up and then look down and look to the left and look to the right. Okay, excellent. So all your fields of vision are intact. So that is great. Yep, you can put your glasses on now.
Okay.
Okay, and would you mind if I inspected and palpated your head?
Okay.
That's fine. Okay. I'm just going to inspect your head. Palpate. Excellent. Okay. And your speech is very clear. Your head seemed great. And your alert and oriented ×3. I'm going to assess your short-term memory. So I'm going to give you 3 words, and then during the rest of the assessment, I'm going to ask you to repeat those 3 words to me. Is that okay?
Sure.
Okay, so tree, dog, cat. Could you say those out loud now just so I know you heard?
Sure. Tree, dog, cat.
Okay, excellent. So I'm going to ask you to repeat those words later on in the assessment.
Okay.
Okay, excellent. So I'm just going to assess your skin right now. So we're going to take a look at your arms, okay, and your legs. Excellent. No skin lesions or skin breakdown. Your skin is warm and dry to the touch and normal to ethnicity. That is great. Okay. And now, if you wouldn't mind, I'm going to palpate and listen to your carotid. So I'm just going to place my hands on your neck. Okay, and I'm going to listen to the next one. Okay. Excellent. Pulses are equal bilaterally and +2. Now I'm going to listen to your carotid for bruits. Okay, I'm going to place this on your neck. Okay, excellent. And I'm moving on this side. Excellent. Okay, now I'm going to assess the range of motion on your neck. So could you please look your head up? Excellent. Down. Perfect. To the left. And now to the right. Okay, perfect. You have excellent range of motion in your neck. And now, if you don't mind, I'm just going to palpate your ears. Okay, and I'm going to do the other one. Okay, that seems normal. Excellent. And could you please say those 3 words I told you earlier?
Tree, dog, cat.
Excellent. You have great short-term memory.
Good.
I'm going to do another test similar to saying of words, but it's called the whisper test. So I'm going to whisper something into your ear, and you just say aloud what you believe that I said, okay?
Okay.
Are you ready?
Merry Christmas.
Excellent, excellent. Just for the holidays, I decided to say that.
Oh, that's good.
Okay, now, if you wouldn't mind, I'm going to check your radial pulses on both of your hands at the same time. So if you could lift them up like this for me. Okay, thank you. Excellent. Pulses are equal +2 bilaterally. And now, if you don't mind, I'm going to do a range of motion on your arm here. I'm going to do a couple exercises to assess that. So if you wouldn't mind, you could lift your hand up. You could lift your down. Okay, then bend at the elbow. Straighten it out again. And we're going to bring it out. And then bring it right back in. Excellent, excellent. Great range of motion. And if you wouldn't mind, I'm also going to look in your nose inspect your mouth, pharynx, and your ears. Is that okay?
Sure.
Okay, so could you open your mouth and say, ah?
Ah.
Okay, excellent. And I'm just going to look up in your nose if you don't mind. Perfect. Your mucous membranes are moist, which is what we like to see. I'm going to look in your ear. Excellent. Perfect. And I'm also going to palpate your trachea and your thyroid, if you don't mind. So I'm just going to put my hand right here. Okay, excellent. I'm going to palpate for your thyroid. Okay, good. So no signs of a goiter present, so that's excellent. And now, if you don't mind, I'm going to listen to your heart sounds first, and then after this, I'll do your lungs.
Okay.
So, excellent. If you could just unbutton that.
Is that enough?
Yes, that's perfect. And also, if you don't mind, I may have to reach down into your gown to listen to all the correct places, if that is fine.
Okay.
I'm just going to reach down. Okay. Excellent. You can just button your shirt up quickly. Okay, so your heart, so regular rate and rhythm, which is excellent. And now, do you mind if I listen to your lung sounds for you?
Okay.
So I'm going to listen to them on the front as well as the back. And when I place my stethoscope on your chest, could you just take a big, deep breath for me, okay?
Okay.
Okay, excellent. And you can exhale as well. Perfect. Okay, now one more time over here. Okay, great. And I'm going to reach up your gown right now to do the bottom.
You want me to breathe in again?
Yes, please. Thank you. Perfect. And one more time over here. Perfect. Now we're going to do it posteriorly. If you could just sit up a little bit and do the same thing. Take a deep breath in and out when you feel my stethoscope on your back. Excellent. Great. Thank you. So your lungs sounded equal and clear bilaterally. And if you don't mind sitting up again, I'm just going to palpate your back and your spine. Okay. Okay, excellent. No signs of scoliosis or kyphosis, so that is great.
Good.
And now I'm going to inspect your abdomen. Is it fine if I lift up your gown slightly? Okay. Perfect. Thank you. Okay, yes. No signs of abdominal distension. And if you don't mind, can I listen to your bowel sounds with my stethoscope?
Yeah.
Okay, I'm going to listen in all 4 quadrants. Excellent, perfect. So bowel sounds were heard in all 4 quadrants, which is great. And I'm just going to palpate your abdomen now. It's fine if you leave it like this. Let me know if this is painful at all. No, and I don't. No signs of bladder distension either. Nick, there was no pain?
No pain.
No tenderness either. That's great. Okay, and how are you tolerating your diet? Are you having any nausea, vomiting, diarrhea, anything like that?
No, I'm not experiencing anything like
Okay,
that.
great. And when was your last bowel movement?
Yesterday morning.
Yesterday morning, and your last void?
I'd say around noontime today.
Around noon? Okay, great. Thank you for letting me know. Okay, excellent. Excellent. And now, if you don't mind, we're going to move on to some range of motion exercises in your legs. So I'm just going to pick this up and have you bend at your knee like this and go forward. Excellent. Then we're going to go straight down. Then we're going to lift it straight up and then down. Excellent. Okay. And we're also going to check your strength in both your arms and your feet. So could you grip my fingers with your hands? Excellent. And can you try to push down on my arms? Okay, good. Now can you push up on my arms? Excellent. And we're also going to check your strength on your feet too. So could you push down like you're stepping on the gas? Good. Now push forward. Okay. Excellent. So you have equal strength bilaterally, which is great. And there's no signs of edema on either leg or anywhere else in the body. And now I'm going to assess your dorsalis pedal pulse and your posterior tibial pulse. Okay, dorsalis pedis pulse is equal bilaterally, +2. And your posterior tibial pulse is also equal bilaterally, +2. So that is excellent.
Sounds good.
Okay, and that is the end of your assessment. If you need anything from me, I'm going to place the call bell right next to you in your reach.
Oh, good.
So if you need anything, you could just press that button, and before I leave, I'm going to lower the bed to the lowest position and put your side rails up. Is there anything else that you need from me before I go?
No, I think I'm all set. Thank you.
Perfect. Thank you, Mrs. Rennick.
Oh, you're welcome.